This is Urban View Mornings, and I'm so excited to be here today with Russell Kennedy, Dr. Russell Kennedy, to be clear, physician and neuroscientist. Russell Kennedy had struggled with anxiety for all of his life, trying multiple types of therapies and medications without success. Following a physical and mental breakdown, he had an epiphany. Anxiety does not start in the brain. He summarized these findings and the techniques he used to achieve them in his new book, his book that'll be new to you. Anxiety RX, first published in 2020. 4 years later, Dr. Kennedy is excited to release an updated version, and revised edition with St. Martin's Essentials on sale right now. This revised edition expands on the healing from the first edition with the addition of new techniques and illustrations and provides strategies and practices for reducing anxiety at the beginning of the book to equip readers right away. At the heart of Anxiety RX is the simple fact that anxiety is not one entity, but two: anxious thinking in the mind and alarmed feeling in the body, with each energizing the other in an invisible feedback loop. I am so excited to welcome to the show Dr.
Hi,
Kennedy.
Almi.
How are you?
Nice. Good, good. It's nice to chat with you.
All right. So this thing called anxiety, I want to start here because I feel like people know what it is, but don't necessarily know when they have it. So let's start with a little bit of your story around when did you go, this is anxiety versus this is just stress, or I'm not feeling good today, or like tell us about some of those differences in between. I'm just having a not so great feeling. I need to just
Yeah.
relax versus like, oh no, this is actually anxiety.
Yeah, I think started late teens. I've always been kind of a high strung, kind of ADD kind of kid, that kind of thing. And I think late teens, I really started to focus on my health, like health anxiety. So I was going to see my doctor on a regular basis, like once a month or so, with different, a different complaint each time. And then went through medical school, went through pre-med actually, and had to get really good grades to get into medical school. So that was another really anxious time in my life. And I just was realizing I was waking up every single day like with this paranoia, like this feeling
Mm.
like I can't get rid of this feeling. And it just didn't feel right. And then I talked to a couple of other different doctors and they said, no, what you have is like anxiety or kind of a PTSD. I mean, I grew up with a dad who had bipolar and schizophrenia. So my childhood, he was never abusive or violent, but there was a lot of inconsistency in my childhood. So I think that sort of sets the stage for a lot of us for, anxiety, depression, OCD, PTSD, all these sort of things. I think most of them start with some kind of separation in childhood. And I certainly had that. So it was just waking up every single day with this feeling of impending doom.
Mm. And I want to speak to that for a second because I think you mentioned like going to doctors as a kid. I mean, that's really for underrepresented communities, that's really not the experience where like you going to the doctor if something is viewed as extremely wrong. And I mean, and that may not, and that means pain, right? Not necessarily, that means pain
Typically.
or visible blood, not necessarily, a feeling of anxiousness. And so can we talk for a few seconds around just how do you recognize that you're experiencing anxiety? One thing that you just mentioned is like the feeling of like doom and gloom consistently.
Yeah.
Are there other things that people should be thinking about that they may be experiencing in their body or they may be experiencing on a regular basis to just come to the recognition that like, oh, I may actually need to think
Yeah.
about whether or not I have anxiety.
Yeah. See how your breath is. I remember, I'll try and
Mm,
mimic it here, but there's this feeling in your breath. You go this, that kind of staccato kind of type breathing. Like if your body is breathing that way, you're in survival mode. And then your brain will just reflect how your body feels. So if your body feels this survival mode, your brain will give you the answers to that in warnings, what ifs, worst case scenarios of worry. And then we start believing the worries. And then when we believe the worries, the physiological alarm in the body gets worse, which of course makes the worries get worse. And this whole cycle, this is what I mean by anxiety isn't one thing, but two. It's the worrisome thoughts in your mind, the warnings, the what ifs, the worst case scenarios. And it's also this feeling of alarm in your body, the higher heart rate, the breathing high up in your chest where you're not quite getting your breath, but you're not really aware of it because you're not really thinking of it. So one of the things that I ask people to do is like check your breath. Like how many breaths are you
mm,
taking a minute? If you're taking like, 10 or 12 breaths a minute, you're probably got some kind of thing going on there.
Yeah, for sure. I think I really love this the study of it being what's happening in the brain and what's happening in the body
Mm.
because I think we don't often talk about it that way. And we don't necessarily always separate brain and body and thinking about how to address them. So I think this is one of the things that is fantastic about what you're doing in the book is saying like, well, how do we address both sides and what does that look like? Do you think the book can be it's designed to be paired with a therapist or a psychiatrist, or is this something that people can go and pick up, kind of see themselves in, and think of solutions?
Yeah, I try and write. I tried to write the book so that you could help you heal yourself because typically psychiatry, psychology still believes in this anxiety as a function of the mind. It's just your anxious thoughts, it's just your worries. So if we just fix your worries, your anxiety will go away. But typically, the reason why we have this survival alarm in our body is because something in our childhood went wrong. We didn't get the attention we needed. We felt separate for some reason, and especially people of color. There is this, you're kind of born with this feeling of separateness, right? So you're born with this sense of alarm already. So, of course, your mind, which is a compulsive meaning making, make sense machine, if it senses this survival physiology in your body, it's going to create thoughts that are completely consistent with that feeling of alarm. Which of course makes the alarm worse, and you get into this cycle. So, to heal, you basically have to separate the thoughts of your mind from this alarm feeling in your body because while they operate together, while they couple together, you can't escape from it.
Do you think so? In separating them, is that separating them to heal them separately and then bringing them back together in the way you're describing it?
Yeah.
Or, okay, okay, got it. And so
Yeah.
in that
So,
case, go ahead.
yeah.
I'm sorry.
No, I was just saying, so what I get people to do is when they feel quote unquote anxious, is instead of going into your mind and just endless ruminations in your mind, search your body. Like look in the midline of your body from your chin to your pubic bone and see if there's an energy there that feels stronger. It's like, when we go through a breakup, we have a pain in our heart. We actually have a physical pain in our heart. And it's kind of similar with this alarm state in our body. If we scan our body, we can find this place. Like in me, it's in my solar plexus, where my ribs meet together. It's hot, it's purple, it's sharp, it's crystalline, and sometimes as a medical doctor and a clinical neuroscientist, I want to have a seizure when I talk about this because it sounds so ethereal. But really,
Mm-hmm.
it's really finding the anxiety, quote unquote anxiety, in your body, because that I believe is a representation of your younger self that still lives in you that is feeding these anxious thoughts. So if we actually fix that connection with the younger version of you, because I believe that anxiety fundamentally is a mind body disconnect where we go up in our heads and we live there, and an adult self child self disconnect where we disconnect from the child in us because the child holds all our pain, and the child doesn't trust the adult in us because we left them alone for so long. So, this separation is what we have to heal. Well, we have to bring these two things back together. So, really, this alarm is really a cry from the younger version of you to get the attention it needed back then, and you give it to them now.
It sound it. I love everything you're saying, and it sounds a little woo woo.
It
You know,
does. It
it
does.
sounds like you said, it sounds ethereal, sounds very spiritual, sounds very much, like you have to be of some type of practice to figure it out. And so I'm curious, in the way you're bringing it forth in the book, is it coming forth in a way that's practical? Like, how do you take such a I don't know what could seem like
Ethereal.
this mystical,
Yeah.
yeah, like
Yeah.
this mystical
Sure.
idea and bring it into a practice for people.
It's a great question. It's finding it. It's really finding the alarm in your body. I have this program that I call MBRX, Mind Body Prescription for Permanent Anxiety Healing, and it talks you through in a video and a meditation how to find this alarm that's stuck in your body. And then when you find it, for me, like I said, it's in my solar plexus. For some people, it's in their throat. A lot of women that I deal with who had domineering mothers or who had mothers that sort of were over controlling have this alarm stuck in their throat. That's where they find it because they wanted to say something to their mother, but they couldn't. So this alarm energy is still stuck there. So I get people, when you feel anxious, put your hand over that area and see if you can just connect with it. And again, I realize it does sound ethereal, but for 40 years, I tried every type of, allopathic, psychiatric, medical
Mhm.
doctor kind of way of healing, CBT, ACT, all these things, and they help a little bit. but they didn't really give me that long lasting relief from anxiety until I found this alarm in my body and started treating both the thoughts of your mind and this alarm that's in your body. Because if you just treat one, if you just treat the thoughts, your anxiety is always going to come back. CBT may help you in the short term, absolutely, but it always tends to come back unless you fix the root cause, which is this alarm survival energy that's stuck in your body.
How do you think it's affecting people in I want to take it into different relationship pieces and give you time to respond to
You go,
that.
girl, whatever you want to talk
Okay,
about. Let's
okay, okay,
go.
okay, cool, cool, cool.
Yeah.
So how do you think it's affecting people at work?
Well, it's a separating energy, right?
Mm.
So when you get alarmed, there's something called the social engagement system. So eye contact, tone of voice, prosody of voice, body language, facial expressions. This is how we interact. This is how you and I are interacting right now, even though we're on Zoom, right? Now, when you get alarmed, we evolutionarily shut off that social part of us. So this is where social anxiety comes from. So if you can't be connected with other people, if you can't look them in the eye, if you can't feel warm and connected to them, you're not going to be able to have a good relationship. And especially in business, I mean, as a venture capitalist, it's all about relationship. Really, I mean, it's money, but really it's all about relationship. So if you can't form that relationship, if you're in such deep state of alarm that you can't make eye contact, you can't have a nice warm tone of voice, you're not going to be able to make those sales. You're not going to be able to make that connection with people. And especially at work, you're not going to be able to make those connections with people. So it's really important to understand that this social engagement system is really something we need. And the alarm in our system shuts that social engagement system off.
Do you think that that could be related to people being like introverts and extroverts too? So like maybe, I mean, do you think that's at all related? Like maybe you've been in a state of survival mode and your body has has shut off this social engagement to a point where you're like, oh, I just don't like to be around people, and so you kind of, in my mind,
Yep.
then you kind of form your whole life to it.
Yep. I think there's a component of that for sure. I think also sometimes extroversion is a coping strategy because people are introverted, but they realize that if I can put on this facade, if I can put on this face of being, overly connected and warm and caring and that people will gravitate to us. So it's really interesting when we look at the introversion extroversion sort of paradigm between the two of them, that it's really kind of just a human, it's just a way of we can make sense of something that has so many facets to it. There's so many facets to introversion. There's so many facets to extroversion. It's really hard to sort of put them into one. It's a helpful concept, but it's not really something that in medicine or psychiatry or whatever that we really use.
Mm. Are you at a point now, right, where you can kind of see anxiety from a mile away? You know, like you meet with people and you're like, yeah, they're probably
Yeah.
or
No.
like let's take looking at debates,
Yeah.
right? Or political
Sure.
commentary.
Absolutely.
And yeah, would you say that like both the candidates in any particular situation, let's not even I'm not necessarily
Yep.
picking on one debate or the other, do you think it could make you better at it, like dealing with this and being able to like really work through this and align, like do the healing part and then do it? Do you think that makes you a better leader?
I think if you can stay grounded within your body and have an argument with someone or an altercation or something and still stay grounded within yourself, I think, yeah, you can learn from that. But if you lose your mind every time someone talks about a particular political candidate, you're not really learning. You're just repeating the same old pattern. And actually, you're ingraining that pattern over and over and over again. So it's really important to understand that you can disagree with other people, but try and keep your center. Try and keep your, physical body, keep your breathing centered, keep your body centered and rational. Otherwise, you're going to go into the same pattern over and over and over. And I see that in the US political system is like people are losing their minds. They're losing the rational part of their brain, the prefrontal cortex. The part of our brain that does our rational thought gets shut off if we get too emotionally lit up. So that's what separates so many things, especially in the US, because people stop seeing the other side as human. They just start seeing them
Mm.
because it becomes your identity. My beliefs are my identity. And if you disagree with my beliefs, you disagree with who I am. And of course, that lights everybody up and it creates this sort of snowball where people get more and more emotional and less rational.
Oh, I mean, it's so interesting. I read this book one time. It's written by a rabbi and it's called Who Needs God Anyway?
Hmm.
And in the book, he talks about how questioning what people believe actually questions their ability to believe. And so, similarly to what you're saying in terms of this, like not looking at people as human, and if you lose your mind every time somebody talks about the size of your rallies, okay,
Oh
I
yeah.
digress.
No, I get it.
Getting back to some of the things you're covering in the book, I mean, give us your like, are there like a top three points that you would want people to walk away with after reading the book?
Yeah, I think it's look into your body when you get anxious. Try and find it in your body because, like I said, I really do feel that this alarm energy is a younger version of you that experienced separation that was too much to bear, like abuse, loss, abandonment, rejection, bullying, and try and see if you can find that energy in your body and be able to connect with it rather than being stuck in your mind. There's
Mm.
no real grounding in your mind. In Ayurvedic medicine, the medicine of ancient India 10,000 years ago,
Hmm.
they used
I've
to
I've
call
experienced
thoughts.
with it.
Yeah, they call thoughts vata. It's air. So your thoughts really don't have a whole lot of grounding, but your body actually does have a lot of grounding. So it's learning how do we go into our body first and stabilize that and then go into our thoughts rather than trying and do it in the reverse. You're much more effective treating your body to calm your mind than trying to use your mind to calm your body.
Okay, I like that. That is so good. You're much more effective treating your body to calm your mind and treating your mind. And I think that, so thinking about it from that standpoint, I feel like when treating like depression, even in treating anxiety, there's a medication that you get that's working with the brain, but
Hmm.
not working with the body. So are we kind of going about that in maybe in our modern medicine? Are we going about it in the I would say the wrong direction according to what your thoughts are?
Well, psych meds, I think, are important, and I think we need psych meds. I'm not against psych meds by any means at all. But what psych meds do is they tend to create an inhibitory place in your brain, which actually does calm your body because it lowers the amount of what's called ACTH from the hypothalamus. I don't have to get into too many details, but basically your brain creates the molecule that creates cortisol in your kidneys, right? So cortisol is your main stress hormone, cortisol and epinephrine, which are both created by the adrenal gland and above the kidney. So when we calm the brain, we calm that signal down to the adrenal glands like, hey, we're in trouble. Hey, we got it. We need more adrenaline. We need more cortisol. We need more stress hormone. So when you calm the brain, it doesn't fire off down to the kidneys to create more of those stress hormones, which calms the body. So again, we can't really separate the mind and the body. And there is a part of our brain called the insular cortex, which is right in the middle of our brain. And it's kind of like the way station between the mind to body and the body to the mind because there's bidirectional transfers there. So I believe that when you're traumatized as a younger person, this insular cortex in your brain creates this emotional signature of trauma, which reflects in your body. So if we can find this reflection of emotional trauma in your body, for me, like I said, it's in my solar plexus, we can kind of access this insular cortex and change that emotional signature so that we're not doing the same thing over and over and over and over again, which is basically what happens with anxiety and depression and eating disorders and
Mm.
to some level personality disorders, all this sort of stuff. It's a repetition. And if we can get in there and change the fundamental root cause of it, then we can start actually healing it rather than either treating it with medication or trying to talk our way out of it.
Do you think that exercise helps? And I say that because is there a place that exercise can't reach? Like I think because there's people who exercise that also have anxiety.
Yeah.
So like is it
Yeah.
helpful? Is it I mean exercise of course we all we think we believe it's always helpful. But does is it enough? I guess is the question.
Yeah, it's a great question. Yeah. I think for a lot of people, you see compulsive exercisers, and that becomes a coping strategy. So if you have, say, your father was an alcoholic and used to hit you when you were a child, you can exercise 24 hours a day. You're never going to get past that. Now, it'll help with the symptoms of it for sure, and it will give you a little bit of grounding in your body. But then you have to use that grounding in your body to say, hey, what's the best bang for my buck here? To use a financial thing. And then, so should I go into my body? Should I find that that child in me that still feels that pain of being yelled at by my alcoholic father? Can we find that
Mm.
child, and can we connect with that child through this sensation in the body? And again, I know it sounds ethereal, but again, I tried every type of, psychiatric, psychology type treatment for anxiety, and nothing really worked until I actually found this alarm in my body and saw it as the younger version of me, and then started giving that younger version of me the care, attention, love, and support that I needed now, that it needed so badly back then. So when you start connecting with that feeling of alarm and, thinking better, that kind of thing, it's not just this, you have to connect with your body, you have to connect with this younger version of yourself. You have to think better too, but it's the combination of the two. So it makes the
Mm.
alarm anxiety cycle. The anxiety is the thoughts of the mind, and the alarm is the feeling in the body, and they cycle on each other. So it's breaking that cycle apart and treating each one of them independently.
What about things like cold plunge, like things that are
Yeah.
really jarring? Like are those helpful?
Well, I love cold plunges because here's my theory on cold plunges. I think that we have this trauma response that's locked in our bodies since our childhood, a lot of us, and we're not used to dealing with it. So we go to what I call MAD, like medications, addictions, distractions, and dissociation. We sort of go into this sort of coping strategy kind of thing. But what cold plunges do is they create a lot of epinephrine in your system. They create a lot of cortisol in your system because it's a stress response. But it also shows you that, A, you're in control. You can get out of the cold plunge if you want. But you can also sit in that cold plunge and you can sit in that pain. And if you sit in that pain, you start to metabolize that pain. If every time you feel this alarm in your body, you run up into your mind and start ruminating and start worrying, you never actually deal with this alarm that's held in your body, and it never changes until the day you die. So what I think cold plunges do is they give you, a sense of control. You can get out of the cold whenever you want, whereas when you were a child and in a horrible situation, you couldn't escape. So it gives you this feeling like, okay, this really hurts, but I'm going to consciously and intentionally stay here in this discomfort so I can learn how to metabolize it and deal with it. So every time it comes up, I don't have to run into my head with worry. I don't know if that makes sense.
No, no, I think it does make sense. And I think it is, I think it makes sense in the sense that it is just jarring enough to pull you out of it. You know what I mean? So
Yeah,
it just, I think so. What do you think? Okay, so let's go like in an opposite direction, like float therapy and like these sensory deprivation kind of
sure.
tanks. Do you think those do similar things?
I think it makes you face your trauma head on. Like when we don't have our phones, when we don't have all these distractions, because a lot of times I think the distractions are to kind of pull us away from the old trauma that we still feel in our body. Not that everything's trauma, but a lot of it is. So when we go into these places of sensory deprivation, this is why people with anxiety or real deep stress don't like meditation, because that you have to face the dragon straight on, right? When there's no other things that are going to pull you away, you have to face your trauma straight on, which there's some benefit from that, because you learn when you face the dragon directly that the dragon actually isn't that bad. And then you learn that you do have the ability to deal with the dragon directly. But when people have a severe traumas, physical, emotional, sexual abuse, like often need a counselor. We need somebody to help us through that so that we can feel safe in our body, along with somebody else that can really help us ground and be able to re-experience those old pain through this feeling of alarm in your body, but still be in a safe environment. So I think it's just
Wow.
creating this, when you go into these float tanks, is that a safe environment for you? Because I know some people get really lit up because they don't have any distractions in there, and they have to face their dragon straight on, which can be terrifying. It's kind of like psychedelics are kind of like that too, is that they take away your ability to think and rationalize and sort of cope with the trauma, and you have to face it directly. And this is one of the reasons I think that psychedelics do help people with trauma, is that they see that, hey, I did face this straight on, it's not as bad as I thought it was going to be, and I do know how to metabolize it now.
Wow. Well, listen, we're gonna have you come back another time to
Yeah,
talk about
sure.
psychedelics
Sure.
because that's a whole conversation we can have. Thank you so much for joining me
Thanks,
today,
Ellie.
Dr. Russell Kennedy. Please go out, everybody, check out the book Anxiety RX, available now wherever you buy your books. And make sure you check out this update because there's some really helpful information in there about how you deal with anxiety, how to one heal the body and the mind, and bring them together as one. So I'm super excited to jump into it myself. I'm hardcore about healing, so like I'm like, let's slay the dragons today.
Yeah.
Thank you so much for joining me. I really appreciate it.
Thank you.
Thank you.